The low energy state, man, is the most powerful concept in all of medicine. Why not start with the best one? Because with the best one, you're about to learn the tip of the pyramid. You're about to understand 1,000 things. But you won't know it until I point it out. Low energy state. It occurred to me one day. This actually came from biochemistry, folks. For all those physicians who say there's no biochemistry out in the real world. This came from biochemistry. It occurred to me one day, this is after I met Dr. Shah, that your body spends a whole lot of time making energy. Why is your body making energy every second of the day? Because every cell in your body has to have energy. Makes sense to everyone so far? Got to have energy. And in fact, some cells need energy more than others. Well then, that means if ever you're deficient in energy, for any reason, whatever that source that started it, doesn't even matter. Your body will respond exactly the same way all the time. Oh, I like this. All the time, I like this. That means I don't have to rethink it. The most powerful concept in all of medicine, man. Who uses energy? Well, I just gave you a nice little list of the cells who use the most energy. Over on the left, the brain uses a lot of energy to think. Muscles use it for release, as you'll learn. Not so much for contraction, but for release. So you need for muscle function. Primary active transport means anything with an ATPase after it. Sodium, potassium, ATPase. Every cell in your body has one. Calcium, ATPase. Muscle fibers have it. Hydrogen, potassium, ATPase in your stomach. Okay? Every ATPase has to have energy at all times. Which means without energy, they all stop. Well, look at the heart. Your heart's beating all the time. Your heart just can't take a break. Can't say, well, barbers are off on Monday, so I'm going to be off on Monday too. Problem is, you'll be off on Monday, then Tuesday, then Wednesday, then Thursday, and that'll be the end of you. All right, so your heart's got to be beating all the time. It's got to have energy. Okay? Look at it. Membrane movement. Endocytosis, bringing things in. Exocytosis, pushing things out. Phagocytosis, bringing large objects in. So membrane movement, got to have energy. Axonal transport. Membrane movement. All right, pinocytosis, when membranes wrap around fluid and electrolytes. Energy. And then over on the right, what did I give you? A list of rapidly dividing cells. Why? Because they use so much energy for rapid cellular division. So when we do biochemistry, you're going to see cellular division. Nucleotide synthesis requires a lot of ATP in order to do. Right, Monica? That's right, Monica said, yeah, and whatever Monica says, yeah, it must be true. Your name? Gretchen. When Gretchen says it's true, it must doubly be true. Gretchen, and then, just give me the first name. Ramathia. What do your friends call you? Ramathia? Okay, then I was trying to look for an easy way out here. You know, in the hood, man, I grew up in the hood. If your name's too long, they give you a nickname. Forget that. They ain't trying to pronounce anything this long. I mean, for like E.H. Rika, you know what they grew up calling me? They always call me Little Eye. My brother was Big Eye. That's it. They're not going to try to pronounce E.H. Rika. Forget that. Big Eye, Little Eye. That's it. You know, so I thought maybe I'd get away with a nickname. All right, so Ramathia. All right, Gretchen Ramathia. This young man right here. Oh, no, wait a minute. Let me just go down this road. Rahul. And Rahul has spoken and Shane has spoken and Asif. So Rahul, Shane, Asif. Gretchen, you ready? All right, look at these rapidly dividing cells, Gretchen. It says skin, hair, GI, respiratory, renal, especially the proximal convoluted tubule. You understand, Gretchen? Then it says bladder, endometrium, endothelium, breast, sperm. You understand, Ramathia? All right, germ cells. Oh, wait a minute. Germ cells. You know where germ cells are? Underneath every cell lining, every epithelial lining, folks, there's a bunch of cells called germ cells. What are they? Cells that can become anything your body needs. They're pluripotent. What does that mean? It means, let's say if I fall on the ground, scrape my skin, I lose some hair, I lose some muscles, lose some nerves. Germ cells will start dividing and become hair, skin, nerve, muscles. They're pluripotent. They can become anything your body needs. So they got to be ready to divide at any one time. And of course, I just said rapid cellular division is going to cost you nucleotides, which require a ton of ATP. So germ cells, got to be ready. Well, look at the cuticles. Not your nails. Nails are dead tissue, folks. Cuticles. You understand? Raul. You understand Shane? You understand Asif? You with me there, Gretchen? And Ramathea is right there with me. Aren't you, Ramathea? All right, then. All right, so the bone marrow can be depressed because it's got to provide us red cells, white cells, platelets, right? So that means if it stops having energy, all those cells won't show up anymore. You understand, Asif? All right, first name. Sharice. Ooh, what? Hepzibah. Now, I remember seeing that name. How do you pronounce it? Hepzibah. Where's that from? From the Bible. Where are you from? That's what I thought. Hepzibah. What do your friends call you? Z. That means I get to be your friend, Z. I get to join the friend list. Non-friends say Hepzibah. Oh, Z sounds good. All right, so we got Cherise, Z, and Amika. All right. So I got that real. All right, cool. All right, so here's all the cells that use energy. You understand, Amika? That means if I'm deficient in energy, do you understand? These cells won't work anymore. You understand, Z? You understand, Sharice? Ah. How do you figure out the presentation of a disease? I got to empower you, man. You don't have to look it up in a book. You don't have to look it up in an article. I'm going to show you how to do it on your own. Look at it, and you'll find it. The presentation of a disease, folks, the way you figure it out is you ask yourself, what would bother a patient the most that they would actually come in to see me as soon as possible? You understand? What would bother you the most that you would come and see the doctor as soon as possible? Well, let me show you. First, I'm going to go back to this list and just turn it into a whole lot of problems. All right, don't write. Just follow what I'm going to do. I'm going to say these areas will run out of energy. So if your brain runs out of energy, if you're a child, you're retarded. If you're an adult, you're demented. In between, you got mental dullness, lethargy, sedation, somnolence, delirium, mental slowness, decreased arousal. All those words mean your brain's running out of energy. All right, go to muscles. Call it muscle weakness, fatigue, exercise intolerance, shortness of breath, decreased cough reflex, constipation, impotence, urinary retention. Ready to follow? All I did was just make your muscles weak and then create problems for you. Okay? In primary active transport, well, the most important one, sodium potassium pump won't work. If that happens, that means sodium gets trapped within the cell. Who comes right after that? Chloride. Who comes right after that? Water. Oh, that means your brain will swell, cerebral edema. That means your eyes will swell, papilledema. That means your heart will swell. That means you got hydropic changes. That means in the lungs, pulmonary edema. That means you get pleural effusion. That means you're going to get ascites. In the GI, we say third spacing. In the liver, we say hydropic changes. In the periphery, we say peripheral edema. If the whole body swells, we say, okay, you got anasarca. All those words mean exactly the same thing, folks. And they've been scamming you guys. Scam, scam, scam. That's all right. I'm about to bust the scam right now. All right, so that's primary active transport. What about the heart? If the heart doesn't work, again, weakness, fatigue, exercise intolerance, shortness of breath. You see that? Decreased blood pressure, decreased ejection fraction, decreased stroke volume, decreased carotid stretch, decreased firing by current of 9. I mean, we can go on and on. That's what happens when the heart doesn't work, when it runs out of energy. And then membrane movement. Without membrane movement, that means your neutrophils won't work. You're immunocompromised now. Your macrophages don't work. Immunocompromised again. Cells cannot do endocytosis. They'll die faster. Cells cannot do axonal transports. Your neurons, you get neuropathy. And then we can go on to more neurological problems. Look at rapidly dividing cells. Skin will be dry. Hair will be dry and brittle. GI, nausea, vomiting, diarrhea. If you can't absorb food, it goes right on through and drags water with it. Respiratory, ineffective cough means more mucus production. That means airway problems. That means obstructive lung disease. That means wheezing, bronchi, crackles. We can go on and on. Renal, proximal common tubule shut down. That means when you do renal, you learn all the electrolytes handled by the proximal common tubule. Guess what? You can tell me every electrolyte problem is going to be a consequence of this disease. Okay? Bladder. That means ineffective contraction. That means predisposed to UTIs now. Endometrium would be atrophic. That means for a woman, she'll be sterile. All right? Infertile. Endothelium. That means blood vessels will fall apart. When blood vessels fall apart, where are you going to bleed from? Skin and mucosal surfaces. Dot hemorrhage, petechiae. Larger hemorrhage, purpura. A larger one, we call it bruise or ecchymosis. Striae. You now bleed from the GI, GU, and respiratory. Bleeding. So that means melena, hematochezia, hemoptysis, all that, hematemesis. We can go on and on. Well, look at the breast. Atrophy. Shrink away. Sperm count, low. That means the male will be sterile now. Infertile. Germ cells. Ooh, wait a minute. Here's a good one. if you wear away my germ cells, if you incapacitate my germ cells, Amika, that means they can't divide anymore. Do you understand? You understand, Z? You understand, Amika? That means if they can't divide, they can't replace cells who died. Do you understand me so far? Now you ask yourself, Z, why would a cell die? One or two reasons. One or two reasons. Well, as far as the body's concerned, that is. Okay? Number one, it was time to die. Okay? Or number two, some mutation occurred. Time to die, we call it apoptosis. A mutation occurred. Your body's always removing mutated cells. Everybody follow me? Everybody with me? Check it out. Name, sir? Nick. Nick, Angie. Ooh, wait a minute. What's that? Bovany. Bovany. How do you spell that? B-A-V-A-N-I. P-A. P-A-V-A-N-I. Bovany. All right, Nick. I forgot already. What is it? I had to concentrate so hard on that one. I forgot the other one. Okay. Nick, Bovany. Angie. All right, Angie. So, now, you understand that cells, when they mutate, you got to get rid of them. Now, all you have to do is ask yourself, what cells mutate the most in your body? Well, Lamika, they got to be cells exposed to radiation. Who are those? Skin, sunlight, bulbs, fluorescent lights. Your skin is exposed to radiation all the time. That means the most mutations occur in your skin, followed by your GI tract, followed by your bone marrow. That means, Sharice, if I lose my pluripotent cells, the germ cells, where's the first mutation going to occur? In your skin. Where's the second one, Z? In the GI. Where's the third one? In the bone marrow. So that means if I have a low energy state and the germ cells cannot divide, the first cancer is going to pop up. Sharice is going to be the skin followed by GI followed by bone marrow, baby. Come on, come on, come on. We're bringing it home. Bring it home. All right, we're just rolling, man. All right, so that's the germ cells. Cuticles, your nails fall apart, dry and brittle. Bone marrow suppressed, so leukopenia, thrombocytopenia, anemia. Now let's go back and apply it. How do you figure out the presentation of a disease, Nick? Nick wants to know, how do you figure out the presentation of a disease? Good question, Nick. The answer is, what makes a patient so bothered? What bothers a patient so bad he wants to go see the doctor as soon as possible? You understand? Number one, when they're so weak they can't go to work. Who's going to pay the bills? That's what bothers them most. So weak they can't go to work. You got to eat. So weak, can't go to work. I'm in the hospital today. Doc, something's wrong. I'm in the doctor's office today. Doc, something's wrong. Number one, presentation of a disease is when there is weakness. And then number two, shortness of breath. Everybody who's short of breath always swears they're going to die that day. That's why they run to the emergency room, run to the doctor, but they will be seen that day. You understand, Nick? You understand, Angie? You understand, Poverty? You understand, Amika? You with me, Z? With me, Sharice? Asif? Shane? Raul? Yeah. Gretchen? Ramathia? Yeah. Okay. All right. Name? Shweta. Name? Shweta, Jesse, Rashid? Oh, Rishi. All right. Rishi. Okay. Shweta. Every time I concentrate on the Indian names, I forget all the rest of them. All right, so Shweta, Jesse, Rishi. All right, Jesse, Rishi. All right, I got a little pattern going there. All right, so Shweta, you understand, the presentation of a disease is what bothers a patient enough that they would want to come see me the same day. You understand, Pavani? Weakness and shortness of breath. You understand that, Jesse? Okay. Signs of a disease, Jesse. Signs of a disease, Asif, is what do you see? You're the doctor. What are you looking at? So all those things I just told you, the things you can see, like dry skin, brittle hair, brittle nails, those are signs of that disease. Everybody understand the difference? Signs, Shweta, means what? What you can see. Everybody understand? Well, what can you see when they come in short of breath? Tachypnea and dyspnea. So that means, Poverty, when they ask you what's the most common sign for a low energy state, you say what? Most common presenting sign for the low energy state, Poverty, you say tachypnea and dyspnea. You understand, Shweta? All right, Jesse. Symptoms is what the patient complains about. Signs you see, symptoms you hear about. Everybody with me? Everybody understand? All right, folks, the reason why this is so important is because one of the biggest errors that students make, answering a question out of context. You're going to hear it day after day, because every time a student makes that mistake, I'm going to point it out to you. You don't realize how easy it is to give away a point, because you answered out of context. They asked for a sign, you picked a symptom. It was right, but you answered out of context. You didn't get anything for it. And you swore you were right, but you didn't realize you were out of context with the question. All right? Symptom. What the patient complains about. You can't pick dry skin. Okay? It's got to be what they're going to be complaining about. Okay? You say weakness and shortness of breath. Doc, I'm weak. Oh, doc, I can't breathe. That's what he's going to come and complain about. All right? So symptoms, weakness and shortness of breath. So signs, Jesse, what does that mean? Things you can see. Sweater, the most common presenting sign for low energy state is what? Tachypnea and dyspnea, pulmonary. Symptom, what is that? So things the patient complains about and his weakness and shortness of breath. You understand, Angie? All right, Angie, let's move on to the next one. The most common infection seen with low energy state, Angie. You ask yourself, what areas, when weakened, predispose me to an infection? Well, if you can't cough up the mucus and germs out of your lungs, you're definitely going to get a pulmonary infection. And if you can't empty your bladder, you're going to have a UTI. You understand, Angie? If I ask the most common infections for the low energy state, what do you say, Angie? Pulmonary infections and UTIs. And she will say it loud with pride in her mind. All right. So signs, what you see. Symptoms, what you hear. Infections, pulmonary and UTIs. Complications. What the heck is a complication? Allow me to break it down for you. A complication is everything else that's going to happen in that disease. Why? Because you're afraid a disease started here, but it can affect various organs in your body. All those other organs being affected, we call them complications. So when you have a heart disease and your kidney shuts down, that's called a complication. Here's the disease, here's the complication. Everybody follow? If I have a renal disease and you go to heart failure, here's the disease, here's the complication now. Everybody understand that? I want you to know how to create it yourself without having to read about it. Okay? So complications simply says when you take any disease and it can affect various organs, then those are complications. Everybody with me? You understand? Rishi? All right, so Rishi. Now, when they list a whole bunch of complications, question is, how do you figure out which one's the most important? All you got to know is what Laura knows. Because Laura knows anytime you got a whole lot of complications, what's the most important organ in your body, Laura? The who? The brain, thank you. Followed by the heart, followed by the kidney. Brain, heart, kidney. As far as importance, that means, Sharice, every time I ask you, the most common complication about any disease you're worried about, what organ do you go to? The brain, followed by the heart, followed by. That means Z. They ask you for complications of hypertension. The first organ you look for is the brain, followed by the heart, followed by. Do you understand that, Amika? Anytime they ask you a complication of a disease, the most important organ you got to think about is what? The brain, followed by the heart, followed by. Nick, are you with me here? Anytime you got a complication you worry about, the first organ you think about is what? The brain, followed by the heart, followed by. Every time, folks. The books don't tell you that. They just list up a whole bunch of stuff for you. But if you don't know what order to pick them, you can pick a lot of right answers, but you weren't racking up any points because nobody told you. Brain must be picked before heart. Heart must be picked before renal. Way before you look at for anything else. But they set you up, all kinds of right answers. They know it's printed right there in your first day. They know it's printed right in the Robbins that you read. And then you forgot what was the real concept behind this question is that brain is more important than heart and heart is more important than kidney. But you just picked a detail, but that was not what they were testing. All right, so complications. Skin, again, I said dry. Hair, you say dry and brittle. Nails, you say brittle. Bone marrow, you say suppressed. So anemia, leukopenia, thrombocytopenia. Well, here's all the other ones. Endothelium, you say atrophic. Endometrium, you also say atrophic. Breast, you say atrophic. Sperm count low. GI, you say nausea, vomiting, diarrhea, because if you can't absorb, you get an osmotic diarrhea. You understand, Rishi? You understand, Jesse? You understand, Shweta? You understand, Pavani? You with me, Nick? Angie? Cool. All right, so then in renal, you say PCT was shut down first. Bladder, atrophic, now you're predisposed to UTIs, Ramathea. Respiratory, you say weak cough, which then predisposes you to infections. Germ cells, Gretchen, you say unable to replicate, so that leads to cancers. And you know in order, what cancer comes first? Skin followed by, GI followed by. Oh, she's been empowered. Y'all better get that girl some elbow room, Monica. Shoo. All right, in the CNS, again, if it's a child, retarded, adult, demented, in between, mental dullness, lethargy, somnolence, whatever you want to say. In the heart, we say heart failure. All right, Rishi, to your right, young man. Ooh, how do you spell that? British, got it. British. Chelsea? Joseph. British, Joseph. British, Joseph. Rishi, British, Joseph. All right, you understand this, Joseph? All right, so that means, Joseph, they ask you what's the most common presenting sign for low energy state. You say what? What? Tachypnea and dyspnea. Tachypnea, dyspnea. Most common presenting symptom, British. Shortness of breath and weakness and infections. Rishi, you got to worry about. Pulmonary infection and UTIs. Jesse, what's your skin look like? Huh? Yeah, what's the skin look like? Dry hair, brittle, bone marrow, depressed, sperm count, low breast size, atrophic endometrium, atrophic endothelium, atrophic, where they're going to bleed from, skin and mucosal surfaces, all of them, not just, all right? And then, of course, we can add bleeding time is elevated anytime you're bleeding from skin and mucosal surfaces, too. All right, what part of the nephron shut down first? What the? PCT. What cancer they're predisposed to if they live long enough? What the? What? Skin followed by? GI followed by? Bone marrow. But now what if they ask you what's the most common cause of death? Poverty, you say what? Heart failure. Say it again, Poverty. Heart failure, most common cause of death for low energy state. Poverty, you say what? Heart failure. Anytime you got low energy state and they ask you what's the most common cause of death, Poverty, you say what? Heart failure. Angie, anytime you got low energy state and they ask you most common cause of death, you say what? Heart failure. Nick, anytime they ask you most common cause of death for low energy state, you say what? Folks, that means every time, each and every time, you can connect to a low energy state, I better hear the same stuff all over again. Let's try one more time. Sir, what's your name? Eric? Eric, Joni, Tarek. Eric, Joni, Tarek, Rob, and Jim. Eric, Joni, Tarek, Rob, Jim. All right, Eric, let's try it again. Low energy state, most common presenting sign is going to be what? You can always look in your notes. I don't want to hear anything new. I don't hear anything new. So give me a dyspnea. Joni, symptom. Weakness and shortness of breath. Tarek, infections. Pulmonary UTIs. Rob, we got to do complications. What organ you worried about the most? Brain followed by? Heart followed by? But what if they just go in line and just say skin? What's it going to look like? Hair. Dry. Bone marrow. Bone marrow. Say depressed. Depressed. Everything's going to be low. All right? Endometrium. Atrophic. It's just not going to grow. You understand? All right? Endothelium. Atrophic. Where are you going to be bleeding from? Skin and mucosal surfaces. What test will be elevated? PT, PTT, or bleeding time? Bleeding time. Breast size. Oh, wait a minute. After Brian, was it? Jim. Oh, that was cool. Right. Anyway. I'll get it, man. All right, so Jim. Where do we leave off? GI symptoms.
Diarrhea.
Yeah, nausea, vomiting, diarrhea. What part of the nephron shut down first? PCT. Sperm count? Low. Where are they going to get the infections at? Respiratory UTIs. If I ask you, what cancer are they predisposed to if they live long enough? Followed by? GI followed by? Bone marrow. Everybody with me? And the most common cause of death. What is your name? Mayuri. Oh, yeah, I remember seeing that. Mayuri. Okay, so that's how you pronounce it. Most common cause of death for low energy state, you say what? Heart failure. You got it down? Mayuri. Do you got it down? Jim, you got it down pat? Rob, you got it down pat? Tree, you got it down pat? Richie, you with me, baby? Pratish, Yon, you right there with me? Joseph, you with me? All right, man. That means every time we connect to the Lord in your state, I want to hear the same stuff. Ramathia, lead me off. Ready? All right, girl. Tell me something about diabetes. What do you know about diabetes? Type 1.5. All right, type 1. Tell me about type 1.
Type 1, you typically see the death.
Tell me the problem. What's the problem in type 1 diabetes? No insulin. What do you need insulin for? I don't get it. Wait. Ramathia? You need insulin for glucose. What does insulin do with glucose? So, and you need insulin to push glucose in the cell. Well, what do the cells do with glucose? Did somebody say something about energy? Wait a minute, Ramathia. Take a deep breath. The most common presenting sign for diabetes is what? Sign for diabetes is what? Sign, Ramathia. You can read off your notes. I don't hear nothing new. I don't hear nothing new. To give me a distance, symptom. Keep talking. Keep on talking. But symptoms. Symptoms. Speak. Thank you very much. What's their skin look like? Hair. Bone marrow. Nails. Endometrium. Atrophic. Endothelium. Atrophic. Where are they going to be bleeding from? Skin and mucosal surfaces. Wait a minute. What test is going to be yellow at? PT, PTT, or bleeding time? Bleeding time. Tell me the GI symptoms. Nausea, vomiting. What infections do they get? What part of the nephron shut down first? PCT. Wait a minute. What cancer can they get if they live long enough? Skin followed by? GI followed by? Bone marrow. What's the most common cause of death in diabetes? Thank you very much. I don't hear nothing new. I don't hear that stuff you've been reading out of the books. Welcome to my world, baby. Pull out any book right now. See diabetes. I bet you didn't know you've been misreading it. That's the clue for diabetes. That is not the most common presentation. See how you guys get scammed? You guys want to quote what your book said? You didn't even understand. My question didn't ask for that answer. That's why you guys keep picking it, and you didn't even know you didn't get any points for it. See that? The question said, what's the most common presentation? You said, no, wasn't it? Mom seen that kid been dragging around for the last 2 weeks. She'll tell you that when she gets in there. Oh, yeah, he's been kind of dragging around the last 2 weeks. But I thought he just had a cold. Huh? The weakness came before the polyurine polydipsia, folks. Look it up for yourself. It'll blow your mind. You've been marking stuff because you read out a book without even knowing how to think it through on your own. And that's exactly what you're trying to weed out physicians who don't know how to think on their own. They just quote books. They quote articles. But they really don't understand what the information is. Z! You with me, babe? You right there with me? Check it out. What do you know about Crohn's disease? You ever heard about Crohn's? What's wrong in Crohn's? I heard there's a disease named Crohn's. Yep. I heard there's a problem going on in Crohn's disease, too. Amika, help her out. She's frozen in time right now. All right, Amika, in Crohn's disease, what's the problem? Oh, look. All right, let me tell you guys something. All right, because they both are demonstrating it. There's something called a cortisol effect. Whenever you get nervous, you know, epinephrine is the first hormone to come out. Even the little amount of cortisol that comes out in that fraction of a second, studies have shown can, boom, block all long-term memory. That's why all of a sudden you start seeing people. Now, you knew it a second ago. As soon as I call your name, you don't know it anymore. Why? Because you feel on the spot. That's why I always want the person who I call to answer, because I feel that part of helping you out is I'm trying to help desensitize this cortisol effect that happens. Because as long as you panic every time somebody calls your name, you won't come up with the answer. I already know that. It's not because you don't know, but I can see the cortisol in your eyes by the way you're responding. All right, Sharice, I got a problem in Crohn's. What's wrong?
You have a problem with your colon.
Crohn's, let's start it in the small intestine. What kind of problem is Crohn's?
Crohn's is a disorder of the mucous membrane.
Well, so the mucosal surface of the GI tract. So the problem is going to be what? If I mess up the mucosal surface, you cannot have Wait. You're moving too fast. If I mess up the mucosal surface of the GI tract, its main function is to absorb. That means you can't absorb anymore. What are you trying to absorb?
Water, electrolytes.
What's the number one thing your body tries to absorb every day? All right. After that is what? Okay, let's just stop at water. What's the number one thing your body needs water for?
The function, the membrane.
What function is that? Talk to me.
To hold the organelle to.
Sounds good. But the number one reason why your body needs water every day?
Don't dehydrate.
Well, you drink to not dehydrate, but I'm saying, what is your body going to do with that water? She just doesn't want to give in. Come on, Cherise, give in, baby. Your body uses great energy, do you hear me? And if there's a problem with energy, tell me again. The most common presenting sign in Crohn's disease is what? Most common presenting sign in Crohn's disease is what? Tachypnea. And, thank you very much. Most common presenting symptom in Crohn's disease is what? Shortness of breath and weakness. What infections do they get? Pulmonary infections and UTIs. What's your skin look like? Hair, bone marrow, nails, endometrium, endothelium, sperm count. Give me the GI symptoms.
GI symptoms. Dehydrated.
Wait, what? GI symptoms. You can just read up. I don't hear nothing new. GI symptoms will be, remember, nausea, vomiting, diarrhea. Oh, what cancer can they get if they live long enough? Skin followed by? GI followed by? And bone marrow, bone marrow, bone marrow. Okay, so that means if I give you all the complications of Crohn's and I ask you to put them in order, what's the first organ you got to pick? What's the most important organ in your body? Brain followed by? The heart followed by? The kidney. You understand? But if I ask you the most common cause of death in Crohn's disease, you say what? Thank you very much. Don't fight it, babe. You can look it up if you want. It'll blow you away. You guys been reading the same old stuff over and over again, but didn't know it. That's because nobody told you. Nick, you with me there, babe? You with me there? All right, Nick. How does a mom know when a child is ill? Let's say he's picked up RSV. He's not himself. What's the first thing about not being himself that she notices? Oh, weak. Did you say weakness? That means the most common presenting sign for illness in general is what? Tachypnea and the symptom is what? Weakness is what infections are you going to get on top of this? Oh, pulmonary UTIs. Look it up, man. Check it out for yourself. Do you know that a low energy state is 98% of illnesses? I'm hooking you up first half hour. 98% of illnesses are low energy state. I'm telling you that anytime you don't understand any question they ask you, default to low energy state. I don't hear anything new. I'm telling you right now, don't give me anything new. Just give me the same old stuff. That way you'll be right 98% of the time. Doggone it, you guys always want to be geniuses. Think about these weird diseases. Try to tell me what Robin said at first day. Said, I don't want to hear it. Just tell me what physio says you ought to be saying. That's a better answer if you want to get a point on the exam. Does everybody understand? So that means, young lady, what's your name? Bindia? Bindia. What's the most common presenting symptom for pneumocystis, cranii pneumonia, and AIDS patients with CD4 count below 200? Weakness, shortness of breath. What's the most common presenting symptom for RSV pneumonia? Strep pneumonia? Aspiration pneumonia? Actinomyces pneumonia? Weakness, shortness of breath? What about histoplasmosis? Blastomycosis? How about cancer? Coccidiomycosis? Chemotherapy? Amika, what's the number one reason for stopping the use of a drug? Weakness, shortness of breath. See how I can apply it 1,000 different ways, folks. You guys can keep on looking at, oh, what's the number one reason for stopping the TCA? What's the number one reason for stopping haloperidol? What's the number one reason for stopping furosemide? Look them all up right now. See if I'm lying. See if I'm lying. It's the same damn thing, but they never told you. That's how it came about. There it is. The number one reason why a patient goes to see a doctor. I'm weak and I'm short of breath, doc. Does it matter if you ask me why he stopped the drug? Why he's got an illness, common cold, virus, fungus, cancer? It doesn't matter to me. I'm telling you the same old stuff. That'll be the best answer. No test writer can change the truth, folks. They can only change the words. That's how they get you guys. They keep changing the words. And students keep falling for it. Just because they change the words, oh, must be different. No, folks, I'm telling you, you better go back to the same old stuff. It'll be boring, but it'll be a high score. It'll be a high score to blow your mind. It's the most amazing thing. Now, here's how they get you. Here's how they get you, Jim. What's the most common cause of death in 30 to 40-year-old white females who got rheumatoid arthritis and they're on at least 10 milligrams of prednisone? Heart failure. Wait a minute. Jim, what's the most common cause of death in lupus nephritis if they require at least 20 milligrams of prednisone and methotrexate too? Heart failure. Wait a minute, Jim. It can't be that easy, man. Hold on, man. No, it can't be that easy. Let me mark something else. That's how you guys do. Well, let me see. I done marked 7 D's in a row. I don't look right. Let me change this one to a C. Let me put an A over here. Yeah, that looks a lot better now. Man, what's that got to do with the answer? If the answer is D 7 times, you better be marking 7 D's. And stop worrying about, oh, it doesn't look that good. That's the right answer. I'm marking it again. That's what will blow you away, folks. It's been the same answer for so long, you guys just didn't even know it. Because they filled your head with so many details, you don't see the concept anymore. All right? That means if they ask you, Gretchen, what's the most common cause of death in America? You say what? What's the most common cause of death in Africa? Ramathi, you say what? What's the most common cause of death from malaria? Rahul, in Africa, you say what? What is the most common cause of death in Russia? Shane, you say what? What's the most common cause of death in India? Asif, you say what? What's the most common cause of death in 3-year-olds in Africa who haven't eaten for the last 3 weeks? Sharice, you say what? Y'all better get off me, man. Y'all better get off me, boy. Better get off me. This is how they fool you, folks. They fill your head with details. You don't even see. It's the same old question coming at you. No test writer can change the truth. You can't go telling me, oh, the cause of death is something different. Nah. What initiated is different. The cause of death, I bet you still the same. I bet you still heart failure. It'll blow you away. Holy cow. Why didn't they just tell me this in medical school? That if you just taught me this pattern alone, I'd have got more answers right if I'd have known this in medical school without going to any more classes. All right. So anytime you connect to lower energy state, folks, don't give me anything new. All I'm telling you, apply the whole thing. Because as we learn concepts, that's what a concept is. Remember the tip of the pyramid, except we're turning it upside down. You've just gotten a concept. So that way when we start applying it, don't give me anything new. Just give me the same old stuff. Now if you want to look it up, you'll be shocked. It's been there in the book, but you were so into the details, you missed it. That's why then when you got the exam, you missed it. Because you picked polyuria polydipsia when they ask you, what's the most common presentation of diabetes? That's the clue. See? That way, when I can get you to see the big picture, the concept, all I got to do is tell you the clue for what disease they want. See that? That way, if I see polyuria aha, I know which lower energy state they're talking about now. See that? Or at least you narrowed it down. This way, you're not all over the place. It also allows you to ignore 90% of vignettes. Because now you understand hair loss, dry skin, brittle nails, that don't mean a doggone thing. But you know how they capture your attention? They call them distractors. They say, well, he's got balding only in the back of his head. Do I really care? You guys do. You try to make up a syndrome. What's that syndrome that bald's only in the back of their head? Go ahead. I'm 3 questions ahead of you while you try to figure that out. Stuff about hair loss, brittleness, folks, I don't even read that stuff. I say, unnecessary. Still doesn't tell me anything. I just read till I see the clue. As soon as I see the clue, click, next question. I say, I know exactly which one they want me to pick now. I'm done. This way you're not trying to figure out everything, folks. There's some things you got to know. So stop guessing. That means you have been empowered in the first 40